just wanted to start with this picture, the before and after injections. They're about 2 weeks apart for a typical male. And I wanted to show you what a woman, young woman in her, she's been with me for, gosh, over 10 years now. So she was probably in her mid-30s. And kind of wanted to show you, to just take a look at them and see what Botox does. So none of them went through face tightening. Face tightening, as we know today, didn't even exist at the time we took these pictures. They are quite old. These pictures are like over 10 years old. But you can see Jamie on top has, like, you can see how his forehead is just so nice and like almost shiny, the way the light bounces off of his face, very smooth when he doesn't have the forehead lines. And just his whole skin, everything looks so much more refreshed. And he's not the kind of guy who applies any kind of skincare or anything else. He used to come in every, like, I don't know, 2-3 years when it was necessary, kind of thing, but it looks good. And I wanted to show you what a typical woman looks like and kind of see, her eyebrow shapes and how her eyes completely open and how we can really open the eyes and look at the shape of her eyebrow versus a male shape of eyebrow. And I like to bring this up, now that I think about it, let's take a little note, because the next slide should be a picture of someone like Sylvester Stallone. We put a little note there, where you can see that whoever he goes to, obviously very wealthy man, but goes to the wrong person, and these eyebrows are completely misshaped, and they look like a woman's eyebrow. And he gets his Botox down, but just gets it done wrongly. So it's really important when you inject someone to keep in mind that, are you injecting a male? Are you injecting a female? Are you trying to feminize a male? And sometimes, some people who are transitioning or that sort of thing they don't want to look masculine, right? They're not ready to transition or whatever. So they're doing just little things to make themselves feel more feminine when they look in the mirror. So those are all cues that are really important for us to keep in mind, how to feminize a face, a woman to a more feminine, beautiful woman, or a man to a woman, or to masculinize it, to make a face more masculine, or keep it masculine but attractive and nice. So we'll talk a little bit, we'll analyze this and talk about it. I just wanted to give you like kind of an idea of where we're going. All right, so what are our weapons to create beautiful faces? Botulinum, aka Botox, Dysport, Xeomin, and Jeuveau, you may know or have heard of all those 4 approved in the United States, are FDA approved. Jeuveau is the latest one. It's made in a company in Korea. But the truth is that all 4 of them last about 3 months. And meaning once you inject them, you don't have too much muscle movement for about 3 months. You can probably extend it to about 4 months, depending on the age of the person. And in very young patients, and now we see patients in their 20s, you can probably extend it to about 6 months. And now they're doing it all prophylactic. So all my patients, I give kudos to all the hygienists and the dentists, because we've taught them, really dentists, we've taught our patients to do everything prophylactic, right? So the newest generation, well, for one thing, it's been around for 20, 30 years, Botox, but we've really taught our patients to do everything prophylactic. You go see the hygienist every 6 months. Why would you not start doing your Botox so you never end up with the wrinkles? So someone like me who has to undo some damage, someone in their 20s will never get there, and they will never age the way our generation has. Some of you, I can say our generation, some of you say, well, my generation. But they'll never age that way. Just the same as we didn't want to age like our parents. They don't, the younger generation doesn't want to age like us. So Botox actually goes really well with hygiene when you think about it. When you're young, in your 20s and 30s, it's pretty much every 6 months, early 30s. And as you age a little bit longer, you have to start coming to the dentist every 4 months or so. Botulinum is the same way. Do it for 3 times a year, and for people who really are like on top of it, it's 4 times a year, but very rarely. Most patients make it last, you know, even in their 60s and 70s who've been doing it for a while. Usually people don't jump into this in their 60s, right? They've been doing it for about, you know, if they started really late in life, like late 40s, early 50s, by the time they're in their 60s, they can make it last like a good 4 or 5 months. The other thing are fillers. That's not the talk for today. We touched base on that last time. We talked about lip fillers and how we do that. So, you know, one of our courses will come back to that. I think the next time in the spring, we'll be talking about fillers, everything but the lips. So how to keep everything up and straight and beautiful. But we have a whole thing that we just did in the spring about lip fillers. Lasers is another thing that's just, you know, there's so much more technology now when it's saying more Morpheus. You can feel and touch some of the machines that we have. We're going to be injecting in 3 rooms, and you'll get to like see some of these machines. They're amazing. They're very expensive. I don't see dentists necessarily buying these machines because they're just like, you know, very, very expensive. You have to have the volume of patients to come and do these services. It's only Botox and fillers, not, you know, something that a dentist can definitely take on and offer to their patients in their offices. And it's a great value to give and provide to our patients. So let's go to the next slide. So I just, you know, wanted to go over about what is botulinum, what does it do, because most of us know what it does, but to just review it. Botulinum, there's 7 different stereotypes, and basically the way I explain it to my patients, I like when I explain, when they come to me, I don't know what fillers are, what Botox is, or they'll say, just give me Botox my face. Well, sometimes it's Botox, sometimes it's fillers. So the way I explain it to my patients, if you think of this as a nerve, and you think of this as the head of the nerve, and you think of the next nerve, this being the tail, this being the body of the nerve, and this being the head of the nerve, brings you back to like immunology or in a synapse, you're going to have something secreted. So this nerve is going to tell this nerve to contract, right? So it's going to secrete here acetylcholine, and that's what happens in the synapse, right? And that's how the nerves work to contract the muscles. So the botulinum is going to come in here, break up that acetylcholine, and as it breaks it up, the nerves are no longer interacting, hence the muscles aren't contracting. And I think the latest research shows that probably what happens, the reason it lasts 3 months, that synapse probably works a lot longer than 3 months, and the nerves just find different pathways to interact. So that's why they're developing. That's the whole premise of developing longer lasting botulinums. And there are a couple of them that may be out on the market in the next year or two. And that, you know, should hopefully last 6 months or even longer. Let's go to the next slide. So I just wanted to go over some of the applications. We'll show and discuss a lot of them, but not all of them because we'll be here for hours. But I wanted to just say facial wrinkles. The obvious are the forehead lines that you saw in the beginning. Then we have the glabella. Those are the 11s in the glabella region. The crow's feet, the smile lines that we don't typically treat until later on. I mean, when a patient is in their, you know, late 30s, early 40s, unless we're trying to do a brow lift, and we'll discuss about that. Bunny lines, you can see on her that she has some of the bunny lines. Those are those lines here along the nose. Necklines, as we get a little bit older, you know, the platysmal bands. And then we can use botulinum to actually contour the face. So brow positioning. So we may inject in a young person who wants to cut that fox-eyed look to raise their eyebrows. We will inject in the crow's feet, and we'll discuss that. Gummy Smile, that's something that dentists should definitely be talking about because way better than ever, like starting to file the teeth and put veneers on and anything. We'll show you some before and after pictures. Lip flip. This is very popular in social media. I personally don't love botulinum lip flip. I've had so many patients come over here and say, I've had my lip flip done and my smile was so off because botulinum affects the muscles and muscle contraction, muscle movement. So I love to do the lip flip. It's beautiful fillers. It lasts forever. And those that may have seen my talk, some of you were on Zoom last time, so you probably saw how I do the lip flip with the fillers, and it lasts, you know, like a year or so. Much longer results, much more accurate and predictable. And I think as dentists, we know we love predictability, right? That's what drives us, right? That's why not everyone loves perio, because it's so unpredictable. It's so up to the patient, but like crown and bridge and fillings, endo, all that stuff is so up to us, right? And I think that's kind of like the personality. So that's why I'm like, the botulinum for lip flip, love the fillers. It's very predictable. Then frown into a smile. We lose a lot of volume here. So a lot of it is fillers to build up the volume here. But for some people, if you put just a little bit of botulinum, and I'll show you some before and after pictures, you can flip that smile within, 5 days. But you can do it in fillers within 5 minutes. Chin and orange peel, those are the people when they talk that they have the orange peel that's down here in the chin. Also, the trapezoids. I know a lot of dentists who do this for themselves because, we get like really tension over here. So it's great for that. It is a lot of units, but it's really nice. It's also really good when people want to kind of like narrow their, like become like a little slimmer. So it's great with people who are transitioning, for example. But it's expensive, I have to say, because it's a lot of units to get this.
How many units do you use for each side?
For the trapezoid, I try 25, like I start with 25 units per side, but a lot of times I feel like it's hard. It's not like, because there's no movement here, right? I'm not trying to like stop all movement here. So it's a give or take, kind of thing. But we'll talk a lot about, I didn't have masseter in here. I don't know, kind of missed it somehow. Let's put that in my notes. We're not contouring, right? Oh, on the bottom, TMJ headaches, masseter, okay, but somehow I think we should put it back in contouring. See what happens, create your slides, you talk, you think you did so well, and then you're like reading it out. Sweating, T-zone. I do a lot of those in the summer. I wouldn't say a lot, but just a little bit. Underarms, very, very popular for sweating, and it lasts a really long time. Also the palms of the hands. Again, this is really expensive, so most people do the right hand, like the hand you shake. Some people who have those sweaty palms, it kind of feels uncomfortable. And then TMJ and headaches. TMJ, I'm huge, masseter, Botox, every dentist should know how to inject this. When you see how simple it is, you'll be like, how did I not do it? And it's just a wonderful thing to offer to your patients or send them to. And then headaches, of course. So headaches, it is a hard thing to say when you inject for just regular muscle movement. You pretty much take care of people's headaches in like 90-some% of patients. Very few patients need like occipital, like injections in the occipital muscle. For most patients, if you just do the crow's feet or you just do the glabella and the forehead, you pretty much take care of their headaches. And I've had some patients here who don't even color their hair, don't do anything, but they'll show up every 3 months on the dot for botulinum. And it's not because they're looking to look like amazing, they do, but it's really, the headaches just, they come right on. So usually when it comes to headaches, I start with the glabella. I worked with a Frontalis just to see if we took care of it, especially if someone young, if they don't need the crow's feet, and obviously more units, it's more expensive. And then we'll work on the crow's feet or, the occipital if you need to. The problem becomes that for headaches, you can get it prescribed, right? So, so then the insurance will only pay like if it's done in a hospital, if it's done with a neurologist or something like that. So Dr. Spiegel's team does it at the hospital, and they'll inject for beauty, and they'll get the same results, even though it's at the ENT department and not at the neurology department. But it's hard for us, and it's probably hard for you as dentists to work the insurance aspect of headache Botox, right? All right, so So I just wanted to, the rest of the dump is going to be all about aesthetics and how to be beautiful. So I just wanted to show you how you go from the left to the right. I just kind of overlap that. And I just think she looks amazing. To get that brow lift, she really has to raise it. And I wish I could show you how to do that, but I can't because I'm all frozen here. But that's the only way she was able to get that huge brow lift. And you could do it with Botox. And now she has no lines and the brow is that raised. And she just looks phenomenal. So how do we do this? So the forehead lines, I just want to say it's about, so I'm going to be giving you some units. You don't need to take any notes. All of what I'm saying is written for you and you can take it with you. So it's somewhere between 7.5 and 12.5 units for the vast majority of patients. The happy medium is about 10 units. And it's you have to, it's people ask me, well, how do you know if you go with that or this? I'll show you some examples, but it's experience, just like everything else. How do you know if you go 2 millimeters or you go 1 millimeter for, occlusal caries or whatever? You take your spoon and over time you just know, it's that kind of thing. And the glabella tends to be between 12.5 and 20 units. I always say err on the safe side. Always go for the lesser units. I always tell my patients the first time I inject you, I'd like you to come back in 2 weeks. Let's take a look, see how everything is. Because after all, it is a toxin. Now, there are no side effects to it, right? As far as we know, no one has had any allergies or anything else. But it is a toxin, and why have more when you, if you can accomplish less sometimes is more. And that's my principle in general with everything, with aesthetics, with everything we do. Less is more. So inject less if you can get the same result. You don't, and the muscles are, stop moving and all of that. Then you accomplish what you wanted, and it will last 3 months. Whether you do 20 or 60 units in the same area, it will last 3 months. That's it. So the less is more. So this is so go back to just that one. So just to that one side over there. So the numbers in general, that's like my notation, are half the units of the X's. So my X's are always 2.5 units. My Y's are 1.25. I'll show you in the room how we drive it. It all has to do with how you suspend the Botox in the bottle. Okay, and so that's how you get to these measurements. We can talk about that later. So let's go to the next one. So I just wanted to show you here. Here it's fewer units because you're going to see some young people. And we go from this to that. You can see how she's really trying to raise her eyebrows. She can't, to create those lines, the same expression she just did. And then the next one, the same thing here, how you get from this to that, just very few units. So what we call that is baby Botox. It's like a term that's like out on social media. And basically it's 20 units, which normally you would use just for the glabella and an individual in your, late 30s, 40s, 50s, etc. The same 20 units throughout for a younger person. And sometimes I would just inject the glabella and every other time inject the frontalis because again, less is more, that same principle, but also you want to try to have as much as you can to raise that, right? So the botulinum does the opposite of what the muscle does, right? So the frontalis muscle raises the eyes. So you want to be able to raise them as much as you can without having those lines. So someone in their 20s, I would just say inject the glabella each time, and then every other time the frontalis. Then you prevent, it's a prophylactic for developing those frontalis lines. And then you really raise their, eyebrows as much as possible. So, so I just wanted to, I'm not here to teach anatomy, but we have to touch base on it a little bit. So the front muscles, everybody here knows these muscles, but, just talk about how we, those function mostly to raise the eyebrow. So you have to be very sensitive in how to inject the frontalis. Whenever you have the droopy eye, and we'll talk about that, it's when you over-inject at the frontalis. You can inject the procerus and corrugators, those two muscles all day long, it's gonna be very hard to create droopy eyebrows. So those tend to be a little bit, but you can go with the corrugator a little too far and you can droop it, not because of the corrugator, because now you touch the frontalis. Does that make sense? So yeah, the frontalis is like the dangerous, and we have to really know how to inject that. The lateral orbicularis, it's a muscle that actually, you know, before I go into that, the medial orbicularis, that's those muscles here. I inject them a lot for bunny lines. Not everyone has them, and you'll see pictures. You have to really analyze the person to see where you want to inject. So it's not like it's a recipe. This is how you do it, and everyone gets done the same. That's why there's no board exams with the biome, you know, because it's not all one fits all. The lateral orbicularis, I inject a lot when I try to raise the eyebrows with that foxy eye look, for, you know, younger people who are, you know, really into it now. And that always helps. So if you ever have a problem with the frontalis, it'll last 6 months. I mean, I'm sorry, it will last 3 months, but you can undo it. And the way to undo it is just inject more in the lateral orbicularis. But you have to test it to see if you have movement. If you have some movement, then you're in good shape. Then you inject a little bit more. You really paralyze the lateral orbicularis, which is down the eyebrow. And then you get to open it a little bit more. If you don't have any movement, you can inject that lateral orbicularis all you want. You're never going to affect that. So something to keep in mind. You know, for the gummy smile, we'll talk about where we inject there. The depressor anculi oris to bring that frown line into a smile. Where we inject the also the depressor inferioris and these muscles here, how we inject in the chin, like for the orange peel, and then we'll talk about the platysma and the platysma bands and how we where we inject there. The masseter, of course, that's a big one for dentists, for TMJ and for, you know, narrowing that side there. Let's see, did I miss anything? No, I think we pretty much covered. And so when I look at the needle there, it's also depending on where you inject, that's how deep or you go into the muscle. So not everywhere do you inject the same. So like the corrugators, the Proceris, you go pretty deep with the needle, but you only go with a 2 millimeter, like a very thin, small needle. And you want to get all the way through. The lateral orbicularis, you go extremely superficial because the muscle is like right there, right? So you almost want to see the little pinpoints where you went with your injection. With the masseter, you go with a really long needle because the masseter is under the vaccinator, like you're really deep there, so you have to go pretty deep. That's pretty much it on this slide. So let's see how we do a little bit of these injections. So you can, yeah, let's pause there right now. So this is the same person. I just kind of want to see. So we'll play that and then I'll.
How old is she?
Okay, you can stop there. We pause there. So she is early 20s, which the age that people are doing it now. I know, hard to believe, right, Kyle? But that's how they're doing it. It's just like, you know, I always use my grandmother as an example. When you see pictures of her in the 40s, 50s, she came from Eastern Europe and she has those golden crowns in the front. You can imagine it by the 1960s, it's all white porcelain crowns, it's beautiful. Same kind of thing. Like nowadays, you see some wrinkles and you accept them, but like in 10 years, you'll look at someone with some wrinkles and you'll be like, whoa, what planet have you been living on? Like it's just unacceptable. And for those in their 20s, they will not accept wrinkles. It's almost like somebody who's like missing a front tooth, you know, be like, or, you know, like, did you not take care of your molars? Like you can, you know what I mean? That's how they think about lines and wrinkles. So I just stopped there because you just saw me injecting the Proceris and you can see I'm going pretty deep. And now I'm into the corrugator, the head of the corrugator, and I go work myself out to the tail of the muscle. And that little that little tip over there, the purple thing there is my little trick. It's like a little vibrator. Makes, I mean, we all dentists, we know we shake it when we go in there. It makes all the difference. I've had so many patients come in here and go, oh my God, did you inject me? I didn't even feel it. Like it's that effective. So I'm injecting the corrugators as I'm working to the lateral, and you can see very few small little injections. Yeah, right there. So I'm going to the right side.
Needle?
It's a 32 gauge needle. Very, very thin, the thinnest, the best. And now I'm going in the frontalis, and you can see, can you pause right there? You can see how far I went. So you can see where I went is I don't go past the pupil, especially in someone that young. She doesn't have a lot of lines. There are no lines in that extend all the way over here. So I'm trying to get her frontalis so she has as much as she can with the frontalis raising it. So she raises her eyebrows, and you'll see that. So notice how I go really mesial, like. The right side, yeah, just pretty much like that. Tiny little outputs, and here she is after. Hardly any movement, and look how beautiful that looks. And pause right there, and look how far we've raised her eyebrow. Okay. And I didn't inject anything in the lateral orbicularis, so her lateral orbicularis is still cooling down. If she was interested in like really raising the eyebrow, we would do that. She has no lines there. She's a beautiful person the way she is. There was no need for that. All right, so now we get to that point that I was showing you in the beginning about a female versus a male eyebrow and what cues us whether we're talking to a male or a female. And you can see what like you always want to accomplish with a woman's eyebrow, like that beautiful, V-shaped eyebrow, or versus a man where you want a really flat eyebrow. What's interesting about this is if you look at their pupils at the eye and the cornea exactly, this is a very female-oriented cornea. This is not. This is not a male. That's a female. A lot of light into the cornea. So with men, you're never going to see this kind of light. But I took this picture offline, and it's just because I'm trying to talk about the eyebrows, not so much about the cornea, people and all that. But I thought that was interesting that the artist didn't pick on the fact that a woman is going to have a lot more light there than a man, because men's eyebrows are a little more forward, and so there's always a little bit of a shadow. So, so again, for our work, because we do see, patients who are transitioning, all of that is something that I have to be very acute to when I'm trying to feminize someone and that sort of thing. But it's really important for anyone injecting botulinum. Like, I'm very sensitive to it because of my patient population, but if you are not sensitive to it, you're quickly going to distort a patient's look. If you're not realizing that you're injecting a woman and you're giving her flat eyebrows, she's not going to be very happy. And vice versa, if you give a man very raised eyebrows and they're trying to be just a guy without wrinkles. So let's go to the next one. So I just, again, that same thing from female to male, going back to that picture we talked about in the beginning. I just kind of want to make sure that really hone down on that, because I think it's really important and something that injectors really need to make sure they know and provide for their patients. So a male on top there. Stop there for 1 second. You can see my design of injection is slightly different. I'm going all the way, especially if an older individual who has more wrinkles. I'm going to go all the way out, and I'm not worried one bit, because I want that flat eyebrow. Does that make sense? And so you can see when he's squinting, now we can no longer squint, but I kept his eyebrow very, very flat. Okay. Versus, and then, just to show you another example, Again, someone squinting and then raising. And so, you know, when he raises his eyebrows, I have to say, if I'm being critical of my work, I think his eyebrow is a little bit too high. I should have gone a little bit further out and fixed it, but he likes it, he can complain, so, you know. But if I'm critical, it's a little too raised there. It should be a little bit flatter. So I'm constantly, you know, criticizing my own work. By the way, all the pictures that you see here are all on our website. They're all our patients, and they've all given us consents to you know, to exhibit their pictures. So let's see how I inject a male. Again, just talking about the corrugate, the glabella, and the frontalis. And again, someone very young. Denzel also works for us, so maybe some of you have spoken to him. His partners with Angelica. So it's easier to get someone who works to agree to film. But you can see, can you stop there right now? His eyebrows are naturally a little bit more raised. So he's also a little bit raised, but you know, much flatter, but a little bit more raised, but they're naturally, if you can see, he's naturally a little bit more raised. And still don't go here past the pupil. Now on the corrugators, yeah.
You still do to keep them 1 centimeter.
Yeah, I just still do, yeah. Because I don't want to droop him.
Right.
Yeah. All right. And look how our glow becomes the faces. Isn't that beautiful? All right, so let's talk about the glabella and bunny lines. And I just put it up there. So what I'm going to do is I'm going to show you how. Is there any way, or is this too late to? I wanted to show the first row first, and then slowly no. Okay, so we'll show it this way, and then we'll do the other way. And today I came this morning, and I was like, Olivia, I need your help. The talk, like I'm just not going to be animation like this. So I just want to show you glabella, and I'm going to show you 4 different individuals, and you're going to be shocked at how different when people squint, how different all their muscle movements and the lines and everything is. But here she is squinting at the top, and you don't see the 11s. You know, some people you just don't, and with her it's all about horizontal. And when she's squinting here, it's gone and beautiful. Let's see the next one. Look at how different when she's squinting. She's got almost like the trapezius going over there. And when you know, they're all gone. These are all after, the ones on top are before, and the ones in the bottom are after. Let's go to the next one. You know, someone who's squinting here, her lines go almost all the way there. She's got very different. If you can see all 3 of them, very, very different. The nice thing is the injections are not that much different. So even though they're very, very different, and you know, one injection doesn't fit, you know, not one injection fits all. In this case with the glabella, I will tell you, it doesn't matter what lectures you go to. Trust me, I've been doing this for so many years, injected thousands of patients. With the glabella, it's hard to screw up, and it's very similar. Like it doesn't matter what their muscle movement is. If you stick to kind of like a pattern, you'll hit it. And then the last one, you know, she has those typical levers, but notice that it's left here a little bit. Well, she's a little bit older. Well, no, these 2 ladies are both in their, you know, maybe late 30s, early 40s, and they're in their 20s. So she already had that line. And this is where I tell, you know, it's like, tell your patients everything in advance. We all have heard about that, because if you don't tell them and you're thinking, oh, this may turn into root canal, but you didn't tell them, and now it's a root canal, you're screwed. But if you told them in advance, hey, listen, this is really deep, you know, the whole thing. It's the same thing here. So I tell it's the first time for her to get injected. It took 40 years or so to get to having that line. It's not going to go away after your first injection. It's going to be better. It's going to look a lot nicer, but it's not going to go away. and we may need to put just a little bit of filler in there. And then she set up for it, and she was thrilled when she came back with this result. I mean, a lot cleaner, a lot clearer. So you have two options. You can either keep on going with the injections and slowly the muscles, because they're not going to contract, it's going to release. And that, I bet you with her, in fact, I know this patient because she's been coming a lot, that line is almost gone, or it's gone, and I never injected filler in there. But if somebody has like an event, you know, a wedding or something like that, and they're really, so I'll always say to them, let's inject it first with botulinum and see what happens, because the last thing you want to do is do filler and botulinum at the same time, because now you've got contractions, you don't know what's working. With botulinum in there, see how it goes. 2 weeks later, if you still have that line, you can inject a little bit of filler in there, get rid of it for the event or for whatever have you, and then just keep with the botulinum, it will go away. Especially someone in their 40s, I would say even like early 50s. You know, it depends. You know, someone who's a smoker or had a really rough life, it's not going to go away as quickly as someone who has, you know, really healthy, young, refreshed skin. All right. So, crow's feet. Well, this is pretty typical. So you see consistency on top and how I inject the lateral orbicularis. Most of the time, they'll get it between 5 and 10 units per side for the lateral orbicularis. I used to do this, but I now almost go 2 rows. So I inject about 5 units here, and then I'll do my 2.5 a little bit lateral to it because of the fox eye. So that I've been doing in the last year and a half or so, because people really want that fox eye look. Whereas I used to go all the way from the top to the bottom, the 7.5. So I've stayed with the same sort of units, same number of units more or less, but I've gone 2 rows, more medial and then a little bit more lateral to get that fox eye look, especially with someone a little bit younger who will tell you about it as soon as they walk in the chair or sit in the chair. So that's crow's feet. Now let's talk about brow shaping. So like I said, you can, okay, so stop right there. This is beautiful, Olivia. So, I mean, obviously, look at before. She has no lines. She's beautiful. She's, you know, in her early 20s, she's gorgeous. But she wanted that eyebrow lift because it's beautiful and popular and it's, you know, and it's sexy and what have you. So we got it for her. And I think with this one, I don't think we did anything in the crow's feet. I think we just did we do a little bit in the
No, you're right.
right? So all we did was the Proceras and the corrugators. I didn't even do her crow's feet, and it just went way up. Now, if she really wanted to go even higher up, which I've done with some patients, I don't always love it because sometimes it almost looks like that crazy V. But I've had patients who really, that's what they want. Then you inject a little bit in the lateral orbicularis, but she doesn't have a lot of movement there. She's still pretty young. So this is one idea, and you can really see the difference. That's that same patient. Look at how high we got her eyebrow. That's pretty impressive.
You just injected the glabella area?
With her, no. So with her, I just with Olivia, we just injected the glabella and just a tiny little bit in the frontalis, just so she doesn't have any lines. After all, she's the person who says hello to everyone that wants to meet us. But she was good even beforehand, but you know. But the second person, I did inject her. So she's a little bit older. She's in like maybe early 40s, like 30s. So with her, I did do a little bit on the crow's feet to really release the lateral orbicularis and get it way up there. And then that's that first patient that you met. Remember that first pictures that I showed you? Well, this is years later. You can see she's losing a little bit in the temples, and that's all the talk for next time about fillers in the temples and all of that. But look how beautiful this is. Like, you know, maybe 10 years later, I don't know, 8 years later, she was, you know, one of my. She's actually not flying from Florida to come see me. But you can see her eyebrows, how high we've kept them up all these years, got rid of all the lines and everything. You can see she's, you know, you can see that she's a little bit older, but really, we really kept her eyebrows up and high throughout these years. I mean, in some ways she looks better, on the left than she does on the right, I think. But I just want to show you that it's nice to see pictures of what someone looks like years later when they just keep on it. All right, next. So, Gummy Smile, right? This is what every dentist wants to know about. This is what everyone asks about. So, that 5-word muscle, the levator labii superioris alveoli quae nasi. Can anyone else say it? I can't to this day. But she's a lovely patient. I just wanted to show you her. She flew to Italy and then we never saw her again. She was in Italy. She gets me a text and she says to me, I am so thrilled. And she'll look at the next picture. Look at her smile over there. Like just gummy smile gone. Didn't touch her teeth, didn't file anything, did anything. 5 units. Not a lot.
5 units total.
5 units total. 0.5 to 0.5. That's almost my to go with. You can go a little bit lower, but then you can go a little bit higher too. But I would do 2.5, 2.5. Bring them back in 2 weeks. Make sure if you see a little bit more, you can add a little bit more. But she's such a cutie.
Where do you inject for that?
There we go.
Great question.
Great question. Here we go. I'm talking over here. We don't have a microphone here, so you can't.
Yeah, I don't think this TV.
But- So, what is it?
I don't think the TV has volume.
Yeah, so this is on our website, and I'm kind of talking about how, beautiful young lady who doesn't like her gummy smile. So here's how I inject it, and I'll show it to you. I just did really in the corner of the nose. So watch how I do this, and you can pause right there. I have them smile, and you can really see that movement. And I inject it right over there. And honestly, I can't think of, as I said, I've been doing this, like when you do something again and again and again, but very rarely do I see a patient that it's like you pretty much nail it the first time. Rarely you need to bring it back. But this is exactly where I inject it. And again, if you go on our website, you can go back and refer to this and see all of this. We're very transparent and we do a lot of education and patients. Right over there. There we go. And this is again just a distractor, that vibration.
What do you charge for that?
For the gummy smile, $2.95.
That's it.
Do you charge per unit or by area?
We don't. We do it by area, and I'm more than happy. I don't know all the pricing. This one I just happened to know because I knew you were going to ask it, so I was ready for it. I was ready. I don't know. You preferred a couple patients to us.
What's your personal favorite bite?
What is it?
What's your personal favorite bite?
That's a good question. Yeah, I've had so many patients go, "Whoa, okay," but they but we can. April, we're more than happy to share prices and things like that, and April can explain all of that. Maybe not tonight, but you can we can stay in touch and that sort of thing. So look at the before and the after. That first patient, she comes, sees me, she's a nurse, and on her way out from work, she always comes here after a 12-hour shift from one of the hospitals. But right out, and the big difference, huge. And it's like 2 weeks later, they just come in. And it's very hard to keep them bringing, because they come in and I never see, right? They only come in for that little Botox. So, but it's nice to see that smile correction. All right, masseter Botox, and now they're a huge one for the dental office. Look at the difference. So obviously T&J, relaxing, all of that. But I also want to show you that it affects the face and very slimming. So it's very popular in Asia, particularly in all over Asia, but particularly it seems like in Korea. So look at the difference before and after. And this is one of our doctors who was a fellow with Dr. Spiegel. And so he was kind enough to have that. But look at the difference. I mean, that's huge. You know, she went from a very masculine, you know, jaw to something a little bit more feminine. Now she's still masculine because her chin is still kind of really wide, and that you can't affect so much with botulinum, but her jaw looks so much better. She's thrilled, okay, just thrilled. And let's see how we do that. See how much longer. It's again, I think it's a 28 gauge needle, but much longer. That's a 19, the 1.5 line. So right there. So what I do, I spread it out to 5 injections. I just ask them to chew, and I literally hold it right there, and I line it up. You can see my hand. I'm just holding it like that. Don't want to go up. If you go slightly up, you're going to affect their smile. So you have to be. That one is a funny injection. The masseter. I mean, funny in that you can quickly affect someone's smile, and that's not what you want to do. So keep it to the lower you go, the better off you are, especially in the beginning if you're not a little more comfortable, because you're not going to do a heck of a lot on top. Like if any of you are clenching, you'll see it's all right here. So there's no need to go up high, and then you'll affect the muscle for no reason.
Why
I
do you
mean, it's
inject in 5 different places?
It just spread it out a little bit, and it's just the volume, the sheer volume to inject that much is going to be a little painful. So it's interesting. So I used to inject 0.1 cc's when I was doing the corrugated for Sarah's. And over time I was like, because I did it myself, I know it's so painful, so painful. Now I'd rather go 10 times, especially if you go the vibrator. You can't see, the needle poke is way less sensitive than the volume. The volume underneath the skin hurts a lot more than going in and out with the needle. So that's why I'd rather do more, less quantity, but more injections. But great question. So, okay, so let's. Okay, let's do that. And then the before and after.
How long does that one last? Oh, I'm sorry.
Oh yeah, no, masseter lasts about 6 months. So Gummy Smile is like the rest of the face, about 3 months. Masseter about 6 months. So again, it works well because mostly it's mostly younger people. With us, it's not as obviously in the dental chair. It's going to be a lot of TMJ. Patients come to me either they were referred by their dentist for TMJ, but mostly it's for aesthetics and to just get that narrow, snatched look.
How much diffusion do you get from Botox? Like for example, if you're trying to target small muscle groups, does it make? And I was thinking about this because we were just talking about the multiple injections of less. Do you find that that's going to be more effective with the same volume of numbing the muscle?
What do you mean by that?
Well, like if you have, let's say, the masseter muscle,
Yeah.
and you have, let's say, you're going to put 10 units in the masseter muscle. Would it be more effective to do, 1 unit, 10 times in different areas, or would it be more effective to you?
No.
It doesn't.
No, and especially because you're going that deep in the masseter, you don't want to. The masseter is, again, I said, it's a funny muscle to inject because it's a much longer needle, and it's different than injecting anywhere else. Anywhere else, you're very, very superficial, and you'd rather go in and out, in and out, in and out. You'll create less damage. I mean, it's just going to be way less sensitive. Whereas with the masseter, it's a longer needle, so you actually do feel it going in a little bit more, but this area is less sensitive than this area, per se. But I find that, yeah, so that's pretty much what I would say. I'd say with all of these, I'd go in more times and spread it out more. And with the masseter, some people will inject like 1 or 2 and that's it. I just think that it's a little painful, that volume there, if that makes sense. So a smile lift. So if we analyze this, and if you go over here, you can see we really lifted her smile with no filler. I think, I don't remember why she didn't want to do any filler, but she didn't. But she's still missing volume. You can see here, she's still pretty jowly, and that the botulinum won't do a lot for her. Like, if you're jowly, you need fillers. Like, right, you need to, that volume loss, you need to regain it. But look how much, like, the tiniest little bit. Oh, sorry, that's the one on top, we need to change the sign. The one on top is for lip flip, and it's the other one that's the,
Yes,
you know what I'm
yeah.
talking about? Yeah. So I'm sorry, the diagram on top is for different, that's for a lip. And this is more, so I basically injected here and here. The difference between here and here is 1.25 each side, so very, very little. It's very little. You could easily do 2 or 3, but I felt like that may be enough, and obviously it was. All right. So the orange peel, you know, that's another area that, like, you can see that in the dental office quite a bit. So that's what I'm talking about over there, and it just looks just much nicer. You can see, yeah.
Is that in the Mentalis?
Mhm.
So the people that are protecting those lower anteriors, this will help relax that.
Yep.
So they can feed easier.
And they can, yep, exactly. And so, yeah, I do a fair amount of this. I wouldn't say it's like the Gummy Smile, you'll see a lot more, the Masseter TMJ, a lot more. But this has about, you know, some people it bothers them, like that they, when they talk, that they, you know, they just so strong. And then let's talk about Nefertiti and neckline. So Nefertiti is from the goddess, the Egyptian goddess, and that's where the term came, like that very snatched look here. And so someone very young, if you just inject, you'll see a video how I injected her just along, just underneath the mandible, you can get that beautiful snatched look. And she didn't need the massive injection to get like that really snatched look. This was all about Nefertiti underneath the jawline. And for someone a little bit older, you'll see these pictures. Look at that before and after. That's pretty darn good. 2 weeks, and probably wasn't 2 weeks then. It was a little bit longer. But no, this is before we did any skin rejuvenation, any kind of face tightening, anything. That this is pure botulinum, just injecting her along the platysma bands. So watch how we do this. You can see here, I'm starting with the platysma bands here. There we go. So I'm taking a little bit slower. It's one of my very early on videos, so it's not as smooth and cool, but next time we'll have that one.
You ever done a whole face everywhere?
Oh yeah.
Like everywhere?
I did a lot of these patients. I do, you know, like a whole bottle of botulinum between the neck, all of this stuff. And a lot of my patients come in for here. So let's just focus on that. What you see her rolling is icing there. Rapid restore. You know, every 6 months, every 4 months, you come in. We'll do the Botox, the fillers. Morphia is something for skin rejuvenation for people who are busy. And let's face it, to afford these things, you got to be a busy person and working quite a bit, unless you got very lucky and the right person. But you know what I mean? Like, then yeah, none of these people have too much lunch.
The muscle there works on the jawline.
Yeah, and it's going to give you that beautiful before and after, that really beautiful look.
Why did you roll that ice along the neck? That
Okay,
to
that's good.
distribute
So
the-
I actually ice every one of my patients before they do the roll. It numbs it up a little bit, makes it a little more comfortable when they
So you
inject.
rolled before the injection?
Before the injection, I roll with every one of my patients. That's actually a good point because none of my videos show it. But the videos, you gotta get to the point really fast, but, very good question. Yeah, I ask all of my patients, you can get an ice pack, but it's nicer to roll. It keeps them busy. So, you know, how like you say to them, okay, I'm gonna inject you now, raise your left leg. It's not doing anything other than getting them to concentrate on that. It's the same thing with rolling. So when I'm injecting one side, I have them roll the other side. And I'm like, no, just roll a little bit like this. And they're really concentrating because, I mean, you would do the same thing if the doctor told you, no, roll it like this, right? And then it takes away.
See the
from
patient roll or you have your
No,
assistant
the
roll?
patient roll.
The patient.
Patient rolls. They've got their hands, they're rolling, they roll the left, and they roll, when I inject the left, they roll the right. And the patient rolls. And so it keeps them busy, keeps the area cool. And then I have them, so if I'm going to the left, now they're icing the right. But you know, you want it very, when you're rolling after you've injected, you want it to be very smooth, you know, just like very gentle. So you tell them very gentle. And you look at them, they go a little bit tough, you're like, gentle, you know. Especially if you start to talk about fillers. Botox doesn't really matter, but again, they're busy, they're doing something, their mind, they're not concentrating on the actual injection. Yeah. So, okay, let's go to the next one. And look at the, like, slow down, because I want you guys to appreciate this. This is huge, I think, you know, like, there was no, these are, you know, pictures from before, like before these patients did any face stacking or anything that I really tried to get like pure pictures that just really show the botulinum. It's huge. So anybody after facelift or, you know, anything with the neck, I just put them right on botulinum to just keep it up the results. Otherwise, if we let it go, you know, let it go. So that's huge. Look at the next patient. Got one more. All these patients have been with me for years. Those three. Now their necks look better than. I mean, it's because now we do face tightening procedures with skin tightening. You can't imagine how, because people forget that their necks, like they concentrate and they pay so much attention, but then you look at a lady who her face looks really good, but then, oh my God, the neck, and then the décolleté looks so old, and you're like, oh, but the back of the hands, I teach all my patients, anything that you apply creams with, always the back of your hands, because the palms, just go wash them, it's all down the drain. So, you know, always at the back of your hands, that will show your age also. So, everyone loves this, right? Complications. Well, we got to talk about that a little bit. So, droopy eyelid, that's the #1 complication that can happen. Is it the end of the world? Listen, it lasts for 3 months, you know, but it's unpleasant. Nobody wants to walk around like that, especially not if you're doing something for aesthetic reasons. So, you got to be very careful how to inject the Frontalis and really keep that in mind. Asymmetry and malpositioning, like injecting a male, like you should be a female. We talked a little bit about that, or an eyebrow that's a little bit higher than the other one. Can you fix it? Yes, you can fix it, and just by adding a couple of units, and you can make a big difference. But that's one of the complications. Bruising, I tell all my patients, if that's just part of what's can happen, but bruising can last. With botulinum, not too bad. I mean, once in a while, you'll see someone walk around with a little yellow or green, you know, from road bruise, but it's not fillers. You can bruise quite significantly more. But it's all how you prepare them. So they are, you know, if you get off fish oils, I find that people are not on fish oils as much as we used to. Like everybody was on fish oils years ago. But even in the summer, I find patients bruise a lot more than they do in the winter. They eat a lot more food, a lot more shellfish and fish and that sort of thing. And you don't think about it, but that's going to make you bruise a lot more. So something to keep in mind. And also alcohol, you know, about 2 days, 3 days before, you know, so especially with young patients, they'll bruise more like Monday, Tuesday, and they will Thursday, Friday, before the weekend. Dry eyes, that's a huge thing, especially with the lateral orbicularis. So I have one patient who looked beautiful, phenomenal for years. I can't even inject her in the lateral orbicularis because she's going to get the dry eyes. This is something to keep in mind. double vision can happen, headaches. I'll have patients who will call me and say, oh my God, I had such a headache afterwards. It takes away headaches, but sometimes you can experience headaches right after the injections for about a day or two, and then that goes away. And sometimes you may have new lines appear. So the most infamous one of those, what I call the Botox Wrinkle, which when you get injected enough, but you don't want to go lateral here, I have them. If I don't, I don't know, but if I have it now, but I often have it like right over here. It's because I don't want to inject anything over here. I'd rather have that little wrinkle, but have my eyebrows go as high as possible. So that's it. And with the new lines, I find that a lot of times patients come to me and say, I never had these lines, like because everything is clear. Well, then I will tell you that if you look over here, you see a lot of lines, right? Now, take a look at that wall over there, right by the Dr. Spiegel. It's like a blank. You probably never noticed all these lines here. Now take a look at it. All of a sudden, those lines are really obvious, right? So what I try to tell them is that when you clean it up, you inject, everything looks nice and clean, you're going to see things that were always there. You just never saw them because the background, it was the background noise. So we can't get rid of everything, because if I did, especially in women, I'd have to go all the way back here and then you get that flat eyebrow. Who wants that? So it's a give and take, and it's all about educating your patient, what you can accomplish and what you can't. Because I'm not crazy. I'm not doing surgery. It's just what the medication can get you. So iodine works great to help with any kind of a droopy eye. It doesn't last forever, but let's say they're going to an event or something like that, and this happened, it will last 3 months. There's nothing you can do about it. It just helps a little bit, if they're taking pictures or whatever, it will help them, you get them through a few hours during a session, or if they're on Zoom or something like that, or they're in an event. But it just to help, it's like a little tool that if you need it, you just know what to prescribe. And then asymmetry, that's another complication. So you just have to know how to undo this. So I bet you she'll want her eyebrows. This I actually took online. So all the complications were all taken from online. She'll probably want her eyebrow like this, right? But so if she could squint and there was some movement in the lateral orbicularis of this eye, I would inject the lateral orbicularis. That would be my first to go to, and try to raise this eyebrow to look like this. But often that may not be the case. She may not have any movement. I may have already injected everything there could be, and I still have asymmetry because maybe the person had gone, maybe I went too far out. So unfortunately, a lot of times you can only make it like the eyebrow they don't like. So, it's just to show you that you have to be really good at what you do. So just like you all are really good at what you do. So anyway, so that's the other complication. Again, not the end, but you just have to, when a patient comes to you for aesthetics, they want it to be perfect. They don't want it to be, so it may not seem like the biggest complication, but for the patient, it really is, especially when they just paid, $1,000 or something like that. So I want to thank you.